Okay, this afternoon we are going to jump straight into our presentation. Um, Interestingly, these two topics are big topics, and I'm not sure if we can cover both of them in one evening, but we will do our best. Uh, we are going to start with the talk on back pain, and then we will transition to um, arthritis as the time allows. So I hope you can see my screen. So back pain is a significant problem in not just in the Bahamas, but in the world. It can be what we call either acute back pain, and back pain usually is back pain that is present for less than 6 weeks. And we will talk about back pain, and we'll also look at chronic back pain. Chronic back pain is back pain present for longer than 3 months. So you can have acute back pain, which because it is not treated properly, it lasts for a long period of time. And once it gets past the 3-month period, it's now considered chronic back pain. In between, you have what people commonly refer to subacute back pain, but we're not going to go into the details of that, except to say that anything between 6 weeks and 12 weeks is considered subacute back pain. But when we talk about the duration, it's either back pain present for less than 6 weeks, back pain present for 6 weeks to 12 weeks, and back pain present for more than 12 weeks or roughly 3 months. Now, this is an extremely common problem. Okay, it's extremely common. At any one point, any one time, it is estimated that between 12% and 33% of the population is suffering from back pain. And we're talking mainly about low back pain now. So at any one point, at any given time, it is estimated that about 12% to 33% of the population suffers from low back pain. Now, just in case you're wondering, well, what makes that significant? That is 12% represents about 1 in 8 persons. 33% represents actually 1 in 3 persons. So you can imagine having 1 out of every 3 persons in the population suffering from back pain. Over the period of 1 year, it is estimated that between 22 and 65% of the population will suffering from back pain. Now, 65% is more than half the population. So over the period of a year, you would expect that roughly about 50% of the population will suffer from low back pain. Now, that may be a little misleading because sometimes you may have an individual who has back pain, recovers from the back pain, and then subsequently, sometime later on, they may develop back pain again. And those 2 episodes may not necessarily be separated in terms, not necessarily be considered to be one individual, because what we're looking at is the number of incidents of back pain as it relates to the population. But it is still a significant number. And then the lifetime prevalence now, between 11 to 84% of the population will at some point in their life have back pain. It affects both males and females fairly equally. The peak incidence is between 30 and 40 years of age. It is the second most common cause for people to lose days from work because of illness. And it is the most common cause for people under the age of 65 to be permanently unable to function in a job setting. It is the most common cause for people under the age of 45 to have to limit their activity. So this problem is not a small problem. Well, let's look a little bit more in details about the cost. And these figures are actually in the United States because we don't have figures. But in 1998, over $90 billion in total health care were spent for back pain. The treatment of back pain costs between $9,000 and $19,000 per person, per patient, per year. Over $13 billion are spent in intervention, either surgery or injection or physiotherapy, some kind of intervention to treat persons with back pain. And 2 to 8% of workforce is disabled or compensated back pain each year. Now, it's important to note though that it is only about 5% of the people with back pain that account for 75% of the cost. So most persons who have back pain are not going to require some kind of intervention, require any extensive management, but about 5% of persons account for 75% of the spending. Now, back pain, let me just get this diagram here. I want you to pay attention not so much to what is written on the disc, but to the on the slide, but on the picture that is being. Oftentimes, we wonder, why do we get back pain? Now, if you're able to see the screen, you will see 2 vertebrae in the back. That's 2 of the bones in the back. And those bones, trying to get the slides a little bit. Yes. Those bones are called vertebrae. So you see 1 vertebra here, 1 vertebra below. In between those vertebrae, there is cartilage, which is, there's a cartilaginous disc. The yellow structure which you see represents the spinal cord and the nerves which are coming off the spinal cord. The red area is a bulge in the disc, and this is what people commonly call a slip disc. So when people talk about slip disc, this is what they're talking about. The intervertebral disc, or the cartilage, has a bulge to it, and that bulge, as you can see, is touching the nerve that is coming off. And as it touches the nerve, it irritates the nerve. You can see the nerve looking a little red. It irritates the nerve, and wherever that nerve, area of skin that nerve supplies is going to be painful. And if that nerve supplies a muscle, that muscle is likely to be weakened. So when people talk about having a slip disc or a herniated disc, this is what they're talking about. But it's not just the disc that can cause pain. There are other areas in the joint, in the spine, such as the joint here, that can also cause pain. There can be a broken bone, what we call a fracture, that can also cause pain. So when we see patients, we have to determine whether or not this is an acute problem or this is a chronic problem, because how we treat the problem is going to be dependent on whether or not it has been present for a short time or it has been present for a long time. Now, for persons who have acute back pain, most of those people don't even go to the doctor. 65% do not seek medical attention. They get spontaneous resolution, meaning the pain goes away within a month. Okay? 85 to 90% of persons who have low back pain will get better in 3 days to 6 weeks. So therefore, most of these problems do not require surgery. In fact, most of these patients will not come to me because they can be treated easily by other means. And like I said, majority of them may not even seek medical attention. Now, of the remaining 10 to 15% out of this 85 to 90% that we talk about, of those that remain, most of them will never get completely well. So back pain can be a significant problem. It can stick around for a very, very long time for those persons who do not get better in the first 3 days to 6 weeks. So now we have to find out what else is happening with the person. What is the history? Do they have any other illnesses such as diabetes, high blood pressure? Okay, what else is going on? Is there any evidence that the nerve is involved? Is there any social or psychological situation which may contribute to that person having disabling pain? And we may speak a little about that a little later on. So when you go to the doctor will look at you. They will determine what your posture is, how you're standing, if you're kind of leaning to one side to take the pressure off, or if you're leaning forward again. Some persons will find that they're more comfortable if they're leaning forward. So the doctor will also examine the spine by touching along the spine to see if there is any area of tenderness. And they will do certain tests where they will ask the patient to lie down and they will lift the foot to see if that makes the pain worse. And they will also evaluate to see if there is any evidence that something else may be causing the pain. And we'll talk about that in a little bit. Now, sometimes persons will come to me and they will say, Doc, you know, don't you think I need an MRI scan? Well, an MRI scan is not warranted unless the person has failed 4 to 6 weeks of treatment. Okay? So if the patient comes in, has not really had any treatment, has not had the appropriate duration of treatment, usually there's no indication for an MRI scan. In fact, there's no any kind of imaging, not X-rays, not MRI, because as we said before, the vast majority of persons will get better without any kind of intervention. Now, there are some signs that we call red flag signs that will cause us to want to image this patient, even if the patient has not had the period of treatment that we talk about. And again, I oftentimes say to my patients, I'm not in the business of collecting information. So if getting a scan or if getting some kind of imaging is not going to influence what I do for you, if it's not going to influence my treatment, then I am not going to request it. I treat patients, I don't treat scans, I don't treat images, and I'm not in the business of collecting information. So I'm gonna just get the information for information's sake. I'm not gonna get it. Okay? So a lot of persons come and they ask about the scan. I need a scan, doc, I need a scan. Oftentimes it's not warranted, and it is because persons have this approach where they want to get a scan, why the cost of healthcare is so high in some industrialized countries. So in countries like the US, where healthcare costs seem to be going up all the time, a lot of times it's because of these unwarranted investigations. Okay, so the insurance company pays for an investigation that's not needed. They have to recover that cost because the insurance company never loses. So if they have to pay for an investigation, then at some point you can be assured your insurance premiums are gonna go up, and therefore the cost of healthcare keeps going up. Now, there are two groups of persons, either those who are less than 20. Well, we're going to talk about the red flag signs, which I mentioned. Some patients will get investigation even if they have not had the period of time of treatment that we've mentioned. Now, if the patient is less than 20 years old, so young people don't usually get back pain. So if a young person comes in with back pain, then that is what we call a red flag sign. It means, hey, something may not be right here. Look carefully. If the person is greater than 50 years at the first episode, that may also be a red flag sign, because what you find is that patients who get tumors and cancers in general, tend to be older than 50 years old. And so if somebody is presenting for the first time older than 50 years old, never had back pain, we're a little concerned about that, and usually we will investigate those persons. So if the patient was involved in an accident, whether it be a car accident or if they were playing sport and fell, if there is trauma, chances are we'll investigate. We get some imaging. If the pain is constant or worsening during that initial period of treatment, so during that initial period of treatment, we would expect that the pain will gradually get better. If the pain is not getting better, if it's constant or if it is getting worse, then we need to have a look at that, okay? And persons who have pain at nights, or the pain is worse at nights, or if they're not in bed, usually, again, those persons are likely to get investigated because they're raising a red flag. It says, look out. If the patient has a history of previous cancer, if the patient has been using certain kinds of drugs, if the patient has fever or weight loss, or if there is any indication that the nerves are under pressure, these are usually times when we will ignore this 4 to 6 weeks that we mentioned, and we will go into looking to see if there is any cause. And when we do our imaging, we either get plain x-rays, we can get a CT scan or an MRI scan. An MRI scan tends to give us a lot of information because it shows the nerves, it shows the soft tissues, it shows the disc, it shows the bone, it shows the muscles around the spine, it shows all these things. So the MRI scan is usually the imaging of choice. Now, for patients who have chronic back pain, we have to recognize that this is a complex problem. It's not as simple as acute back pain. And we look for what we call yellow flags. And yellow flags may be whether or not there is some psychological, behavioral aspect to it, whether or not there are certain beliefs which the person holds to, which may result in them presenting, if there are social issues. And then the other big one is occupational. If people get injured on the job.
Well, that ain't the right thing.
What we have found is that persons who get injured on the job tend not to get better. And that's a difficult problem for doctors. Persons, like I said, who have psychological issues, so whether depression, anxiety, irritability, persons with poor coping skills and so on. When we talk about belief, there are some people who are always thinking that, something major is gonna go bad. Some persons who believe that their pain is uncontrollable. Those persons are usually difficult to treat. Persons who believe that pain is harmful. So if that person expects that this requires some major kind of intervention, those persons oftentimes do not get better. Persons who don't have a support system, okay? And as we mentioned before, persons who get injured on the job. So we may or may not do lab tests, but sometimes a patient's expectations may not be realistic. There are many persons who we present the situation to them, and what they are asking for us to do may not be possible to do. And then the treatment can either be with medicine with surgery, or treatments without medicine and surgery. What do I mean by treatments without medicine and surgery? I'm not going to go into too much details about the medication or the surgery, because those are details that you would discuss with someone who is currently having back pain who requires treatment. Now, bed rest, one of these marks is supposed to be a T. Exercise actually helps. Now, chiropractors do what we call spinal manipulation. Some persons have found acupuncture to be useful, physical therapy. So these are all things that do not involve medication or surgery. And we talk about exercise because what you find is that a lot of persons actually need to strengthen their core muscles. If you can strengthen your core muscles, you tend to take pressure off the spine. Okay, so exercise is important. It is important to rest and to rest comfortably. And when we talk about bed rest, you want to make sure that the mattress is nice and firm, not too soft. You want to make sure that you're sleeping in a good position, not just sleeping. Now, some of the things that are likely to require surgery, we look for. If persons are unable to control their bladder or so on, those persons may require surgery. If there are causes such as infection or problems with the blood vessels, or if there is a tumor, those persons oftentimes require surgery. If the bone is broken, okay, if there's an infection, if there is a loss of the stability, meaning the person is progressively becoming deformed, or if we look at the images and we determine that based on the images, this thing is not likely to be stable. So what I want to say is that in the absence of red flag, we should not be doing certain tests, all right? And with that, we have come towards the end of our talk on back pain. What I'm going to do at this time is that I'm going to open the floor for questions, sorry. And then after we've had some questions on this aspect, then we will quickly go through arthritis and what is arthritis and what are some of the concerns. Are there any questions?
Dr. Chambers, hello?
I'm hearing you. Go ahead.
Good evening. I was just wondering if you're going through the phase of having the back pain, you're taking Tylenol for it. If you're in that acute stage, like within the first 6 weeks, to see, and you're trying to manage it, is it okay to take Tylenol, during that period to see if that would give you some relief? Would you recommend taking painkillers during that time?
Well, Tylenol is one of the medications that you can actually get over the counter. And yes, medication will help. So I have no objection to someone taking someone taking Tylenol if they're having back pain. However, you have to know when to seek medical attention. And that's why I spoke about the red flag signs. If you see certain things happening, if there is numbness or weakness, if there is a lot of pain, the pain is worse at night. If you find that if in patients who are under 20 years old or over 50 years old, there are some indicators, okay? So yes, it is okay to do a trial of Tylenol and see if there is any improvement, okay? And then if there is worsening or if there is no improvement, then to go back to ensure that you seek medical attention.
What if the pain is worse in the mornings?
If the pain is worse in the mornings, then it is suggestive that that may be related to your sleeping situation, whether it is sleeping in a bad position or whether or not the mattress is too soft. Usually those are the causes of someone waking up with back pain.
Thank you.
Especially if you find that the pain gets better as the day goes on.
Right. Thank you.
Okay.
There are a few chat, Dr. Chambers.
Go ahead.
First one is, can back pain cause neck pain?
Well, okay, not necessarily. However, neck pain, when we talk about the neck, that is also part of the spine. So while the talk is focusing mainly on the lower back, you can also get pain which is the spine at the level of the neck or at the level of the upper and mid back, because it is the spine, and the same things that we talk about that you can get in the lower back as it relates to a herniated disc, as it relates to trauma. You can also get these things in the neck. So someone who has low back pain is not exempt from having neck pain because it's still the spine that is involved.
And another question, can arthritis cause back pain?
Okay, so you can have arthritis of the back. Yes, you can have, because you have, when we talk about arthritis in the next few minutes, when we talk about arthritis, we'll go through some of the details of exactly what it is, but you can also get arthritis in the back. And so arthritis can be a cause of back pain.
Can walking more than 30 minutes a day help with back and neck pains?
Okay, as I mentioned before, exercise is important. One of the things that walking does is that it improves your posture. It also helps with weight control, both of which can be factors to back pain. Okay, now we have to recognize that sometimes, depending on the cause, it may not respond to walking. Okay, if you have a cause which requires surgical intervention, for example, you have a lot of pressure on the nerve from a herniated disc, that may not respond to walking.
Is it a cause for alarm if there is a back pain in the upper back only when a person exercises?
Okay, so if you're having pain only during exercise, it may mean that you're doing something incorrectly during the exercise, okay? And it may be wise to, get a trainer, even if it is that you don't necessarily have to take out a gym membership, but you can pay for 1 or 2 sessions, work with a trainer, learn to do the things appropriately, and from that, you can then return to your exercise if you're exercising at home, and you can manage your back pain.
Is it a red or yellow flag if there is a pain in the lower back when a person sleeps on their stomach?
Okay, it's not a flag. However, it means that that individual is putting too much pressure on the lower back based on that particular position. In fact, for persons who have back pain, one of the positions that I usually recommend for them to sleep in is on the back, not on the tummy, but on the back with 2 pillows under the knee, okay? What that does is that it allows you now to bend the knees and to bend the hip, and that straightens out the spine a little bit, and it takes the pressure off the lower back. what you find is that if you're sleeping on your tummy, then you're not able to get into that particular position. If someone is sleeping on their side, then I would like for them to try to put a pillow between. What the pillow between knees does is that it prevents them from over-rotating the lower part of the spine, and therefore it keeps the spine straight.
If you had a herniated disc but worked with a physiotherapist, and is it okay? What advice would you give about returning to the gym?
Okay. We actually have physiotherapists. I'm not sure if we have any physiotherapists on the chat, but one of the treatments for lower back pain is physiotherapy. So during the initial period of treatment, I send patients for therapy. All right. Once the pain goes away, once the pain settles down, then returning to the gym is possible. However, there are certain what we call strenuous activities. So if you have to strain, okay, it can allow that disc, it allows pressure on that disc, and it can worsen the pain. So there's nothing that says that the person cannot go back to the gym, but it is dependent on what kind of exercises they're now going to do at the gym. You may have to modify your exercises, and so it's important to work with a trainer.
Another question, I have a lot of pain in my lower back every time I stand for more than 6 hours. What do I do?
I would suggest that you do not stand for more than 6 hours. That's a long time to be standing for. It it may seem strange, but understand that standing for 6 hours is like standing from 8 o'clock in the morning until 2 in the afternoon. That's a long time to stand. I'm surprised that some only get back pain doing that. I would expect you to get leg pain, knee pain, because that's a long time to stand. And under very rare circumstances, I can imagine someone standing for 6 hours. Now, when you talk about standing, that's separate and apart from walking around. Some persons have to stand for their jobs. But if you're standing, even if you're on the job, you are entitled by law to certain breaks. So it's hard to imagine that someone is going to stand for 6 hours. Now, what I do, and sometimes during, let's say I have a long surgical procedure and I have to stand for 6 hours because I've had surgeries which last that long. What I do is I stand in such a way that I can put one foot up on a step, whether ask for what we call a step stool, okay? So by putting one foot on a step stool or by putting one foot on the base of the bed, you kind of take some pressure off the back, and you know, that makes it more comfortable. So if you have to stand for a long period of time, unless you're in the army, what I would recommend is that you know, find something to just raise one foot off the bed, maybe about off the ground, sorry, maybe about 4 inches or so, 4 or 5 inches, and to make the back more comfortable.
Should you sleep on the floor or in your bed on your back with the pillow?
Now, some persons will say they're more comfortable sleeping on the floor because the floor gives them a hard surface. Remember, we mentioned making sure that the mattress is firm. So what you find, you know, is that sometimes if you are in such a situation where your mattress is soft, okay, then sleeping on the floor will help if you're having back pain. And I just want to say we do have physiotherapists on the call. I just glanced at the names that I see there, and I recognize that there are at least 2 physiotherapist that I can see on the chat.
What does it mean when you feel heat in your lower back?
I'm not sure what kind of heat you're talking about, but usually if someone has a burning pain, that is pain which is related to the nerves, if that's what you're talking about. I hope that, you know, that answers the question, because I'm not sure what is meant by feeling heat in the lower back. If it's completely isolated to the lower back, then chances are that it's talking about nerve pain. But if felt elsewhere, then it may be related to some other thing. Okay. Also, you know, sometimes someone has an infection. If there's an infection, let's say an abscess collection, if there's irritation, one of the signs of inflammation is actually heat. Go ahead.
What does it mean when the bottom of your feet burn? Does that have anything to do with the lower back? According to Google, it could be nerves emanating from the back.
Well, it could be. It could also be something that we call plantar fasciitis, which has nothing to do with the nerves. But a burning sensation could be nerve pain, as I mentioned before. Usually if you're burning, that's nerve pain, but there's something which is called plantar fasciitis. And what a lot of patients will describe is that when they have, it feels like they're stepping on hot coals. So it may or may not be related to the back. It depends on what else is going on.
How is sciatica treated?
All right, sciatica means that the sciatic nerve is being irritated, and it can be irritated by numerous causes. So the first thing that we have to do is to identify what is causing this. And then based on what the cause is, then we will treat. It may be related, it could be related to a herniated disc, like we mentioned before. So if it is related to a herniated disc, then we focus our treatment on that. It could be related to an abscess in the area of the sciatic nerve where it is coming off. If it is related to that, then we treat it. So it depends on what is the cause. That is going to determine how we treat it.
That ends the questions in the chat, and I don't see any hands raised. So I guess at this point you can continue with your presentation on arthritis.
Okay. Now, let me start by saying arthritis I'm just preparing to share my screen, so just give me a moment. So when we talk about arthritis, I think I need to get back to the screen sharing. Just a moment. Great. Okay. Are you able to see my screen?
Yes.
Yes, we can.
Yes.
Okay, good. So when we talk about arthritis, okay, usually we are talking about wearing out of the joint surface. Okay. Now, arthritis can be either what we call osteoarthritis, which is arthritis that comes from wear and tear as people get older and they put a lot of pressure on their joints, or arthritis could be inflammatory. When we talk about inflammatory arthritis, we're talking about things like rheumatoid arthritis, which is treated in a different way because of the cause, okay? And then arthritis could also be what we call like gout, so on. Because arthritis, when we talk about arthros is the Greek word which joint, okay? So arthritis means inflammation of the joint. So it could be from either from an inflammatory condition such as rheumatoid arthritis, it could be from something such as gout, or it could be from wearing out of the cartilage. The one that we're going to talk about today, the osteoarthritis, okay? And that is the arthritis that usually comes, you hear grandma had arthritis. As people get older, they wear out the cartilage. Now, what is cartilage? Cartilage is that shiny white structure which is at the end of the bone. And for those persons who eat chicken or who eat meat or who have eaten, end of the bone, there's a white crunchy part that we oftentimes call the gristle. That is cartilage. And what cartilage does is that cartilage gives you a smooth surface on the end of the bone in the joint so that you can have friction-free movement, and it also acts as a shock absorber. Now, also in order to get that friction-free movement, there's a small amount of fluid in each joint. As we get older and as we, well, when we're young, we tend to pay no attention to safety, put a lot of stresses across the joint. Now, that's not necessarily a bad thing, okay? Because you want to remain active. But what you will find is that high impact activity, jumping, that sort of thing, running on hard surfaces, those tend, like I said, it's a shock absorber. So those tend to put a lot of stress on your shock absorber. If you're driving your car and you have a lot of potholes, you know, we live in Nassau. Some roads are not as smooth as some. So if you are driving your car around Nassau and you have these potholes, over time, because of that jarring, because of that impact that you get every time you fall into the pothole, your shocks are going to go bad. And it's the same thing with the cartilage. Over time, it wears out. What that does is that the joint now loses that smooth surface, which is useful for friction, to prevent friction. The joint now loses that shock absorbing ability. And as a result, you get pain, inflammation, swelling, fluid collecting in the joint. Okay? So osteoarthritis is related to use. The pain tends to get worse during the day. In the morning, there tends to be some minimal stiffness, or after inactivity, call that gelling. There may be loss in the rate of motion of the joint. So when you're young, you can bend your knee all the way back. As we get older and we lose some of that cartilage, you find you can't bend it as far before it becomes painful. Sometimes the joint even becomes unstable. It feels like it's gonna give way. And there's swelling around the joint, okay? Movement causes pain, so movement is restricted. And when you move the joint, you feel like there is crackling as you move the joint, okay? So there are no specific tests for arthritis, okay? There may not even be any abnormalities if tests are done. Now, sometimes you may find some products that come from the fact that the cartilage is broken down in the joint fluid, but you may not. Persons who are over the age of 75 tend to have arthritis. 75% of persons over 75 have osteoarthritis. Females are more likely to get arthritis than males. Persons who are obese tend to get arthritis because you're putting more weight across the joint, so you're more likely to get the cartilage being worn out. There are some persons who have an inherited tendency to arthritis. Some persons who may have had an injury, trauma to the joint, and that trauma disrupted the joint surface. So after that injury, the joint surface is no longer smooth. What that tends to do is that leads to further wearing of the cartilage. So that person gets what we call post-traumatic or after injury arthritis. Now, if you look at these images, the white structure, okay, that yellow and brown structure, that's bone. So you have bones on the two sides of the joint. Then you have this gray structure, which looks like something wrapped around the joint on both sides. And at the end of the bone, you have this white structure. That is the cartilage. If you look at the second picture, you can see how the cartilage is breaking down. And in the third picture, you can see that the cartilage is almost completely gone. So the distance between the two bones, the two ends of the bone, is much less. Okay? So what you find is that this is what happens in arthritis. And as a result, you get worsening pain, stiffness, and difficulty moving because the cartilage is worn as a result of the arthritis. Now, arthritis typically tends to involve joints that are involved in weight bearing. It's not commonly seen in joints that don't involve weight bearing, but it is commonly seen, but it may be seen in the hands, okay? When we talk about the weight-bearing joints, we want to talk about things like the knee joint and the hip joint. Put a lot of weight across those joints. Sometimes the ankle joint. As I said before, you may get it in the hands. And you can get secondary causes. Talk about trauma and certain other diseases. Okay. Now, there are some specific diseases that we will ask our patients about. Now, we're going to move on from those technical details to talk a little bit about how we treat this problem, this common problem. So in order to determine that this person has arthritis, we have to look at x-rays. Well, we take a history first, then we examine the patient, then we look at x-rays. Having determined that this is arthritis, in order to get persons functioning optimally, we have to make sure that the pain is decreased. So in order to increase function, we have to decrease pain. So exercise is important even in these individuals who have joint pain, and we progress with the exercises to make sure that when someone is starting off and they have severe pain, we're not asking them to go and jog or do some strenuous exercise. Otherwise, they will not do it. Okay? So you want to gradually increase function, and then you increase endurance and strength. And by doing those things, you actually reduce the risk of patients falling. Okay? When you strengthen the muscles and you improve your joint function, patients will walk around better, and therefore they're less likely to fall and injure themselves. And like I said, arthritis tends to occur in the elderly population, so we have to watch out for this. And then you want to tell the patient things that they can do for themselves. Okay, weight loss, as I mentioned before. If you're putting a lot of weight across the joint, then not only are you more likely to wear the joint out, you're more likely to have pain. So if we can reduce the weight that is being put across the joint, then it helps. Now, mark you, I recognize that weight loss is easier said than done, but it is still something that we can strive for. And then, you know, hot packs or cold packs can be used to help in reducing the pain. What heat does is that heat will cause the blood vessels to open up. It increases blood flow. What that increase in blood flow does is that it will remove some of the factors that will cause pain, some of the chemicals that are likely to increase the pain. That increased blood flow is likely to wash. Okay, so it opens up those blood vessels, it increases. What cold does is that cold reduces inflammation. So cold is going to cause the blood vessels to contract down. Okay, it's the opposite of the heat, but both are useful at different times. And then we can give medications, okay, including the Tylenol that was mentioned before. Some topical agents are also useful. Sometimes we give injections in the joint. Sometimes we give very strong medications like opioids, depending on how severe the pain is. As we mentioned before, exercise is focused on decreasing pain and increasing function. So physical training rather than passive therapy is more useful. Okay, you want to warm up with range of motions, and you lift body parts against gravity. You progressively increase your resistance, and then you cool down. Okay, you want to do low impact exercises. What do I mean? There are some persons who will do insanity, okay, or plyometric exercises, which involve a lot of jumping and so on. Those are not the ideal exercises for somebody whose cartilage is worn out. And I usually recommend cycling, okay, because cycling is no impact. I usually recommend swimming, okay, use of something like an elliptical. Definitely not jogging on the concrete, because jogging on the concrete is just going to wear the cartilage out more. Walking, we normally recommend walking on wood surfaces and so on. We don't have those here in Nassau. So in order for persons to exercise, they're either on concrete or on asphalt. Then we talk about the use of Tylenol, which is acetaminophen. We talk about other medications, okay? I'm not gonna dwell too much on the medications. Therapy, we spoke about injection. And some things that you can buy over the counter like OsteoBioflex and so on. Now, you know, whenever, because it is older people who get arthritis, we normally recommend that you let your doctor know what else you may be taking that is over the counter, because sometimes these patients are on other medications. So you want to let your doctor know what else you may be taking. Okay? And sometimes we have to do surgery, which may include arthroscopy, where we use a scope and a camera and we look in the joint. Or we may have to realign the joint, or we may have to do what we call total joint replacement. But we're hoping that you have to get to the point where you require surgery, because we're able to control the pain with non-surgical methods, and therefore we can improve and maintain function. But if we get to the point where surgery is what is required, then surgery is required. And if you find yourself in that situation, then that is something that I can assist with. Okay? So first we have to be sure that this pain is related to the joint. We have to recognize that the initial treatment is usually physiotherapy, non-pharmacological treatment if that is required. So physiotherapy, strengthening exercises, weight loss if that can be achieved. And then when we start with the drugs, usually we start with those that have low side effects, such as the Tylenol. And there are some home therapy methods, such as using heat or cold. I personally will recommend going to the physiotherapist, because what the physiotherapist can do. Now, some persons think that physiotherapy is equivalent to exercises. There are a lot of other things that the therapist can do, okay, such as ultrasound treatment, electrical treatment, what we call transcutaneous electrical stimulation, okay, such as just teaching you the right way to do an exercise. The physiotherapist can be helpful. Also, things like the use of infrared laser lights. So physiotherapy is not just exercise. There are a lot of other things that the physiotherapist can do. And we have come to the end of that presentation. So I'm going to now open the floor for questions. We've been going for about an hour.
There are several questions in the chat. There are a few from the first presentation, taking your back. Can you get arthritis in your knees?
Absolutely. The knee is one of the major joints that gets arthritis. It's the most common joint for that persons will seek medical attention for arthritis.
Question, the back question is, how significant is weight loss in regards to helping with a herniated disc?
Very significant. It results in a significant decrease in pain, because it decreases the pressure that you're putting across the joints in your back.
Another question, I strained my back many years ago changing around furniture. I only receive pain medicine when I attend the doctor, but the pain keeps coming. What can I do?
So you will remember that I said that chronic back pain is different from acute back pain, okay? And if someone keeps having symptoms, then that individual is someone who will need some kind of imaging, some kind of investigation to see what is the cause of that back pain, especially if that back pain is preventing you from doing your daily activities, if it's debilitating enough that it affects your daily activities.
Can footwear, example, flat shoes, cause your back to be thrown out of alignment?
Not usually. You know, we talk, when we talk about flat shoes, remember we weren't born with shoes. And so if you're walking around without shoes, then you will be walking on the flat. That is actually more natural than wearing shoes.
Is it true that salt water is good for arthritis?
I didn't get that question.
Is it true that salt water is good for arthritis?
Now, I must say that this is a question that is commonly asked, okay? Can I go in the seawater? There is no magic in the seawater. It's not a panacea to treat everything. What I will say is that it can be used for as a type of therapy. So I'm not sure if there is any great gain or loss because it's salt water, but a lot of persons seem to find it helpful. So I would never say to someone, don't do something that you find helpful. But you know, there is no real medical reason for the salt water.
Okay. Experience of a double spinal tap due to the first tap being done incorrectly. Can it be a cause of back pain and a weakness in muscles to cause fasciitis in the knees?
Okay. That's a difficult question to answer because I'm not sure what is meant by the first step being done in if during a procedure there is injury to the nerves or the spinal cord, then that can cause back pain. That can cause pain in the lower limbs. So if that is what is meant by incorrectly, then I suppose injury to the nerve can result in pain. But it's not likely to result in a bursitis in the knee. It can result in pain and weakness, not likely to cause a bursitis.
Okay. Would you say that, and I think you answered this, would you say that wearing high heel shoes contributes to back pain? If so, is there an acceptable amount of time per day that you can wear the heels that will minimize the pain from wearing the heels?
Okay, now I recognize the challenge because of the significant importance of high heels in the culture of our in our female culture. It is like staple. So to answer this question, I'm going to be treading on some dangerous grounds. But what I would like to say is, if you find that wearing high heel makes your back painful or uncomfortable, then you may want to choose, then you now have to make a choice between fashion and comfort. And you know, you may want to choose fashionable low heel shoe that will not aggravate the back pain. That's as much as I can say about that matter without getting into trouble.
Next question is, I do have a herniated disc. It has been very painful for the past few days. On Sunday past, my lower back gave a heated sensation. What is the treatment to this?
Okay, if you do have a herniated disc and you're having significant pain, then I would recommend that that is a time to seek medical attention. So I would say go see the doctor. Because it could be a worsening of your herniation. So you know, to just ignore it, I could recommend that.
Okay. Are there any natural remedies that one can take to help to minimize the possibility of having arthritis in the future, especially where family members have arthritis?
Okay. To prevent arthritis, I cannot say that you will prevent arthritis by the natural remedies. There are certain lifestyle changes that you may want to make, as I mentioned before, with regards to impact, because once you're putting pressure on the cartilage, you're likely to wear out the cartilage. Now, having said that, when I was growing up, people used to use cod liver oil a lot for joints. Things like osteobiflex, those are actually natural things. There are some fruits which are said to worsen arthritic pain, such as tomatoes is one of those that people talk about, may worsen arthritic pain. So if you find that you have a natural trigger, you may want to cut down on your usage of that. And exercise, I think those are the natural things that we can talk about.
Can your cartilage grow back?
Doesn't usually. It doesn't usually. Cartilage does not have a blood supply. So when it gets damaged, it doesn't heal very well. It actually gets its nutrition from the fluid, which I mentioned that is in the joint, as opposed to having blood flowing into it. And so when you get injury to your cartilage, it tends to be, that doesn't grow back if you lose your cartilage.
Can spinning cause OA in the knee joint?
Now, as I mentioned before, okay, I normally recommend cycling as exercise for persons who may have arthritis. So in theory, spinning should not contribute to arthritis, but I do recognize that spinning is not just cycling. There may be some strenuous periods of cycling, you know, so while I don't anticipate that spinning can cause arthritis, as someone who has never gone on a spinning program, I can't say all that spinning entails. I just know that it involves cycling, but it should not cause arthritis.
I have a side front knee pain when squatting. What might be the cause and how can I resolve?
Two things cause pain when squatting. Problems that are related to the back of the kneecap, so the joint between the back of the kneecap, what we call the patellofemoral joint. And secondly, if there is a tear to two special pieces of cartilage which are in the knee, on each side of the knee, we call them the meniscus. If you have a torn meniscus or if you have a problem with the cartilage at the back of the kneecap, those usually cause pain on squat. Now, incidentally, meniscal injuries are a common cause for surgery. So if this pain on squatting is related to the knee giving way or the knee locking up, swelling, then I would say seek medical attention.
What is the best sole to wear to minimize shock to the knees?
That's a difficult question. I'm not going to recommend any particular brand, but you want something that has something gel-like or something that that can absorb shock within itself. So if your shoe soles are already absorbing some of the shock from the impact of the foot with the ground, then it less of that impact is transmitted to the knee.
Okay. I am 51, overweight, and experiencing right hip pain on and off for several months. I just started walking for 30 minutes, 4 times weekly, but that is a bit painful. So I started using a stationary bike. Do you have any other recommendations?
Okay. Now, I must say, hip pain, what is described as hip pain, is not always hip pain. Okay? Pain that is felt in the buttock is not hip pain. That's back pain. Hip pain is felt in the groin. Okay? So we have to differentiate between the two. If that pain is felt in the buttock, then we treat back pain, and we have already spoken about back pain. If that pain is felt in the groin, then we have to then, based on the other symptoms, we have to determine how to investigate that individual based on what else we get in the history, how to investigate that individual. And then based on the cause of that pain, we will treat the pain. But the question is, does the use of the stationary bike improve the pain? Because that wasn't included in the question.
Okay. What causes early onset arthritis?
Usually trauma. Persons who might have been might have had an injury to a joint, or persons who are heavily involved in sports, they may get early onset arthritis. Some persons also have an hereditary tendency to arthritis, as we mentioned before, so that may also contribute.
Are there different phases to arthritis? Are some phases more amenable to non-operative treatment than others?
So yes, there are 4 phases to arthritis. That's usually based on the X-ray findings. Okay. And of course, the mild and moderate arthritis is more likely to respond to the non-surgical treatments than the more severe types of arthritis. So the answer to both questions is yes.
Is turmeric tea good for arthritis sufferers?
I have to say I do not have the answer to that question. So I wouldn't venture to offer advice on that one.
Okay. Can I just go and do therapy before doing an MRI? Or must I do an X-ray MRI first before going to therapy?
Okay. So if you are being sent to physiotherapy by a physician, usually the therapist will, the physician will make that determination as to whether or not it is necessary. And most times when we send patients to therapy, we do not necessarily have to provide imaging. So you're going to be evaluated by your physician, who will then determine whether or not, in order to make the diagnosis or in order to treat the problem, imaging is required. If the physician determines that imaging is not required, then they will send you to the therapist. And the therapist is not going to the therapist may have a discussion with the physician if they have concerns, but usually that is something which is settled between the therapist and the physician. So the patient doesn't necessarily have to go on their own to try to get investigation to go to the therapist.
Do you have any nutritional or dietary advice or recommendations that can help decrease pain symptoms?
Okay. Now, it is said that some things will help with pain, such as cayenne pepper. Okay. Some things may worsen the pain, such as I mentioned before, meters are said to worsen the pain of arthritis. Outside of that, you know, it is something that I would have to consult a dietitian.
If you have arthritis in your knees, can it transfer to your pelvic area?
The arthritis itself does not transfer. However, the nerves which supply the knee pass through the hip, pass over the hip joint. So you can get groin pain with a knee problem, or you can get knee pain with a groin problem. But the arthritis itself doesn't transfer to the pelvic area. The arthritis remains in the joint. As I said, the arthritis is loss of the cartilage, so that is specific to that joint. Now, can you have multiple joints involved? Absolutely.
You mentioned exercise as a help for arthritis. Are there certain exercises one should avoid that might aggravate or make that arthritis worse?
We did say that high impact exercises should be avoided. So if you are aggressively loading a joint in which there is arthritis, then that is going to make the situation worse. So I recommend cycling, swimming, use of an elliptical, avoiding things like running on the concrete or on asphalt.
When do you recommend surgical intervention? After repeated steroid or plasma injections?
Now, sometimes steroids are temporizing, they're for temporizing, okay? Steroids will not solve the problem of arthritis. And steroids, if you're giving steroids, that will require repeated injections. Usually, most people will give them every 3 months. We prefer to not give them over long periods of time, but some persons will get them for a long period of time if there are limitations to having surgery, okay? Now, plasma or PRP, platelet-rich plasma, is a completely different thing. It has been shown to help with the pain, not just of arthritis, but other problems of the joint. But it doesn't necessarily solve the problem. And sometimes just by looking at the imaging, you can have a fairly good idea if this individual requires surgery without going down the road of repeated injections.
If someone has a torn lateral meniscus, is that an indication for a total knee replacement?
Let me answer this question carefully. Initially, if someone has an acute injury with a torn lateral meniscus, that is not an indication for surgery, for surgical intervention. It's not an indication, well, let me not say surgical intervention. It's not an indication for a joint replacement. It may be an indication for an arthroscopic procedure. However, if that torn meniscus is ignored for a long period of time, and that torn meniscus now leads to arthritis, which it can, then severe arthritis may be an indication for a total knee replacement. Next question.
Can having an epidural lead to nerve damage resulting in back pain in the future?
Not usually. I have to say that there is no procedure which is without risks. This is low risk for an epidural to lead to nerve damage. Theoretically, yes, there is the, but it's very, very low.
Can you elaborate more on why back pain expresses itself in the hip?
Again, as I mentioned earlier, when we talk about the hip, we have to be specific. Are we talking about buttocks, or are we talking about the groin? Hip pain is felt in the groin. Buttock pain is back, and therefore, if it's not an expression in the hip, it is where it is a part of the whole pathology of the problem. So somebody who has back pain can have pain in the buttock, it can have pain going down the back of the thigh, can have pain in the legs, can have pain in the foot. All of that is related to the back. Because the nerves that supply these areas come from the back.
Okay. If I have arthritis in my knees and I'm having back stiffness with a loud clicking sound when I bend, is it likely arthritis in my back also?
It's quite possible. It could also be a herniated disc.
Some women have started complaining of upper left hip pain years after hysterectomy. Is this nerve related or due to arthritis?
I have not had that complaint, so I cannot answer the question. I've not had someone who presented to me to say I have had a hysterectomy and I have Where did you describe the pain? Upper.
So some women have started complaining of upper left hip pain years
Upper
after this. Yeah, upper left.
I'm not sure if the two are related. They may not be.
There are no further questions in the chat, and I see no hands raised at this time. Well, first of all, Philip Paul here. I would like to thank Dr. Carlton Chambers for his very informative presentation on taking care of your back and arthritis, and on behalf of Good News 7 Adventist Community Service Department. We are very thankful and grateful for you spending time and your expertise with us. So thank you much, participants, for your attendance, your questions, and we look forward to seeing you next week, and we'll encourage you to invite a friend.